where we can talk more specifically about movement that we can do in the little way. Because what we've found is that women that are going through these changes in our life, it's overwhelming already, right? And so what we're trying to do is make changes that are sustainable. And the way that we do that is in the little way, which is so tied to our ministry at Little with Great Love. Hey, I'm Lisa Martinez, the founder of Little with Great Love. We are a restoration ministry, and I'm here with my dear friend, Romina Profeta. I almost said Principato because that's how we grew up together, right? So Romina and I actually went to school together, and I'm back in Michigan at her Pilates studio, which is called
Tower Therapeutic Fitness and Wellness.
And Romina is here today to talk about, well, we want to talk about Pilates, but we really want to talk about moving through menopause with grace, right? Because there's a number of us ladies that are of a certain age, or maybe that we've gone through medically induced menopause as well, or you know, your mom, your sister, your colleague, somebody's going through it, and it's something that we don't talk about very much, but we really need to kind of open up the conversation about menopause and things that can help us move through it with grace. And so we want to talk a little bit about Pilates today, and Romina is the person to talk about it with because she actually is a physical therapist, and she has been a Pilates instructor for how long?
For 7.5 years, but I've taken it myself for probably 22 years.
Wow. Yeah. So I'm going to have Romina talk a little bit about her background right now so that she can share with you kind of where she gets her knowledge from. And then we're going to move into a time where we can talk more specifically about movement that we can do in the little way. Because what we've found is that women that are going through these changes in our life, it's overwhelming already, right? And so what we're trying to do is make changes that are sustainable. And the way that we do that is in the little way, which is so tied to our ministry at Little with Great Love. So Romina's going to start kicking us off here by sharing a little bit more about herself.
Okay, so I graduated from PT school in 2001 from Wayne State. And then I had the urge to go back to school. I was thinking of going back to medical school, but I felt like God wanted me to be here as a physical therapist. So I returned to Oakland University and did a residency program in manual therapy, and then completed my doctorate in PT. I did the certification in Pilates about 7.5 or 8 years ago, and I started tying it into my rehab clients, and then I started teaching out of my home. And then my co-owner, Tamara Bobby, and I, who's a speech therapist, we decided we wanted to touch more people, and so we decided to open up this studio.
Can you tell us what is Pilates?
So Pilates it goes back a long time ago, and obviously people have heard the name Joseph Pilates. So there's a number of exercises there. You can do Pilates on mat. You can, of course, use these machines that we'll talk about soon. But it all goes back to these principles. There's 5 principles. We talk about breathing. We talk about pelvic placement. We talk about our rib cage placement, our shoulder blade or scapula, and our neck. So Pilates is full body, but all these principles are incorporated into exercises. And there's beginner exercises all the way up to advanced exercises. So it's really important to understand the principles and to go to someone who can really teach you those principles so that you can get the best benefit out of the exercises.
Yeah, and we want to also put a disclaimer here in this video that if you are making any changes to your exercise routine or you're trying to implement something like this, it's best to talk about it with your physician, right? So even though we have this expert here today in Romina, and she's going to give us great advice, that make sure based on your body and what your issues or injuries may be, that you should always talk to your physician, right? So now that you've explained what is Pilates, we want you to tell us a little bit about these machines because they look a little bit daunting for those of us who are lay people, right?
Okay, so this is called a reformer with a tower. So not all of them, you can actually have just a reformer without the tower, but the tower incorporates what's called the Cadillac. So you can do about 80% of the Cadillac exercises and you convert this reformer into the tower. Okay, so if you can look back there, these two are converted. So It's a pulley-based system, the reformer is, so there's different spring tensions. And the nice thing is that when you exercise, you're moving that, your body through a concentric and eccentric contraction, meaning you have to control the movement or, you'll slam the reformer back in. So it makes you have to control, slow down your movement. The Cadillac springs are a little different because it's not on a pulley. So they are a little bit sometimes more challenging, but just, different. So generally speaking, when you're looking at a group class, you'll usually see reformers in a class when we have like a larger class, where like the Cadillacs are in a smaller class because you have to do a lot of switching around of the springs.
So for those of us that are kind of going through some changes with our hormones, why do you think Pilates is a great way for us to exercise?
As we go through menopause, there's lots of different changes. Obviously, our hormones drop. We are at higher risk for osteoporosis. And Pilates is great because it's not a lot of pounding. You're in a position that's, non-weight bearing potentially, but you can do weight bearing exercises also. But, it helps with improving your potential bone growth if you have like a risk of osteopenia or osteoporosis. I have a couple older patients that have already had some improvements. It helps with just like using your mind-body connection. So as we go through menopause, sometimes we can have brain fog, anxiety, even like feeling kind of like depression, down. But it's really nice with the breathing just to kind of like calm your mind and just be really like in tune with your body as you're doing the exercises. And that was one thing for me that I enjoyed even before menopause, because I tend to be a more hyper person. So like I really enjoyed the breathing and then just the mind-body connection.
Especially, myself, I've had a lot of injuries and issues with my neck, with my lower back. I might feel a little self-conscious about some of the weight that I've gained, from menopause that I haven't. They call it the meno belly. This video goes along with Bridget Holtz's blog, which talks a little bit more about some of these issues. So I hope that you'll go read that as well. There'll be a link there. But for those of us that have like injuries or issues with neck, with back, all those kind of things, what do you think about Pilates for us?
I think it's important that you go to someone who knows how to modify things. There's lots of different modifications. And I tell all my clients that, if they're feeling something, strained in their neck, there's a way that we can adapt the exercise so that they can still benefit from them, but they don't, get injured. So I think it's important that you communicate with your trainer and that you go to someone who knows how to modify each exercise so that you can get the best benefit.
Love that. And I think, seeing someone like Romina, if you're local, we'll, at the end of the video, we'll share more about her location and things like that. But if you're not local, like myself, I'm going back to Austin, what I should be looking for, right, is somebody that maybe has a background in training, physical therapy.
Yeah. Not every Pilates instructor is a physical therapist, and there are many great Pilates instructors. You just want to find someone who, knows what they're doing and has like a background and has done it for a while.
We're going to try to show maybe a few things that could help us get started, right? So what we're looking for, she'll maybe show us a thing or two on the machines here, but also a few things that can help us get started, just to strengthen in our core, maybe at home, because I think a big way that we want to promote health is just movement and getting started. So if you feel a little bit overwhelmed by going to a studio and working, paying for classes or something like that, we'll also give a few things that can help you with your core and maybe some mat work, because you explained that also, it doesn't have to be done on a machine, correct, right?
No, it doesn't have to be on a machine. Yeah, so you can do this at home. Yes, definitely.
Yeah. So we're going to start with something on the machine, and then we'll do some things that you can also do at home.
So I'm going to describe and show you what's called footwork, which is very traditional for the reformer. So footwork, you're going to be laying on the carriage. And again, we put these springs on. We have what's called the red spring is a single spring, the blue is a half, the white is a quarter. Okay? So we're going to lay on the carriage. with our feet on what's called the foot bar, and we're gonna find what's called pelvic neutral. So pelvic neutral is how God intended our back to be. So there's a little curve back there, and we try to engage our abdominals and keep it very tight, arms, palms open, and we take an inhale, and exhale, we push the carriage back and return. And nice and easy, and we wanna make sure that we're not hitting that stopper. So as I mentioned before, we're getting to work the muscles in both directions because we have to control the carriage as we come back, okay? So there's a number of positions with our feet. So of course we're working our legs as well, but again, everything comes back to the powerhouse, and then we're adding our breathing as we come out, exhaling to engage your core more, inhale, right back. Okay, so there's a couple other different foot positions that we can do, working on different muscles as we push the carriage back, but again, focusing on our core. Okay, so that's like very like typical of reformer. Good. So the next exercise I'm going to demonstrate is called back rowing. In back rowing, we're sitting. I'm putting myself on what's called a platform extender just because I tend to have tighter hamstrings, and we want to be able to sit up again in that neutral spine. And not just women, men too, but when we're in this position, I always tell my clients to think about lifting up nice and tall and engaging their pelvic floor. Because as we get older, sometimes we experience some like urinary incontinence, and strengthening these muscles will help with that, that issue. So we're gonna stand up nice and tall. Again, we're looking at our neck position, our pelvic position, in our scapula. So we're gonna take an inhale, exhale, we're gonna push back, and then inhale, return, keeping our spine vertical without any movement as we push the carriage back, okay? So the second one I can show you is what's called open elbows. So we're gonna come here, we're gonna open, keeping our ribs closed. We exhale as we open, we inhale as we close. Again, ensuring that we're not leaning back and we're staying nice and tall on what we call our sit bones, or in anatomy, our ischial tuberosity, ensuring that we're staying in neutral. Next exercise I'm going to demonstrate is more of an advanced exercise, and again, you want to make sure that you're strong enough and that the instructor that's teaching you this ensures that you do this properly without any injury. So it's in a sense, it's kind of like a plank, but on the reformer. So again, you have to make sure your pelvic positioning is correct, your shoulders are solid before you lift up, and as you push back and then return. So a really great exercise. But the good thing is we have modifications. So if someone can't do the full exercise, we can keep our knees down, still get a great workout, but making sure that we work up to the harder exercise and making sure that we don't injure ourselves as we do it. One of the most important principles is breathing in Pilates. And so in Pilates, we focus on a posterior lateral breath. So in the kind of bottom outer part of the ribs. And the reason we do is oftentimes people like keep a lot of tension in our neck and we don't fill our lungs properly. So it's important to teach people that, and you think it's intuitive, but it isn't, because due to stress, we a lot of times keep tension in our neck and in our shoulders. So as we talk about this, a simple thing that you can do first without the TheraBand is just sitting. You don't need to be sitting up on anything like this. You can just be sitting and just softening your head here. And you can even put your hands on the bottom part of your ribs, and you're gonna take an inhale and then exhale. And what you're feeling for is that you're filling those ribs, almost like imagine an accordion, going lateral and closing. If you happen to have a TheraBand, this kind of gives you a little bit of biofeedback, so you can wrap it around the bottom part of the ribs, cross it in the front, and put a little bit of tension here. As you inhale, and as you exhale. So as you inhale, you can see the TheraBand loosening, and then as you exhale, you tighten it back. So it's a nice little exercise that you can do to ensure that you're actually breathing in the correct manner. So now I'm going to show you a really simple exercise. It's more of a mobility exercise, and it's called CAT. And many people probably have seen this in other exercise routines, but in Pilates, we really try to focus on moving each segment so that we're moving through stiff segments that might not be moving as well. So we're going to start in all fours. Okay, and we're going to be in neutral spine, so a little curve in the low back. Our head is, again, same thing in neutral. We're going to take an inhale. Exhale, we're going to start nodding our head, pushing through our arms, and imagining dominoes falling. And as we hold here in the round back, we're going to take an inhale, and then we're going to release our low back, our mid back, and our head. So it's a really nice mobility exercise, as well as thinking about disassociating movement between our cervical, our thoracic, and our lumbar as we just mobilize our spine. So in Pilates, as in every exercise, we talk about, in Pilates, we call it an ab prep. People call it crunches, but oftentimes people struggle with that because they are weak in their core, and then they use their neck, and then they end up having neck pain. So there are a few things that I give my Pilates clients as well as my PT patients to use to make sure that they don't cause any neck issues. So you can either use a towel to wrap around your neck. We don't have a towel right now, but what I use in the clinic or in the studio is what's called a Pilates circle. So as I'm lying down, I let the circle just kind of be right over the skull bone, okay? And I'm going to try to be in pelvic neutral, meaning I have a little bit of a curve back there. I'm going to take an inhale. Exhale, I'm just going to curl up, hold, and then right back down. And my head is not experiencing any sort of tension because the circle is supporting my head, and I'm focusing just on my core. Now, if we want to make it a little bit more difficult, we can go in what's called tabletop. So we bring one leg up, the opposite leg up, and we do the same thing. We can crunch and then return. But ensuring that when you're doing this, that you're not pulling your head if you're using the circle or the towel. We want to make sure everything is coming from the core. So I'm going to show you a hip flexor stretch, which is not technically a Pilates exercise, although we do something on the reformer that does stretch this muscle. But I want to show you something that you can do at home. So the hip flexor, it's a large muscle. There's two muscles. There's the psoas major and the iliacus. So the psoas major goes up into the lumbar spine. So when that is tight, that can actually cause some low back issues. Okay. So when we set up, you want to make sure you have a pillow at home. This is a piece of foam. And you want to make sure you have something to hold on to, at least one side. You're going to bring one leg forward, one leg back. You're going to imagine that you have a tail between your legs, and you're going to think about tipping your butt, kind of squeezing your butt and tipping your pelvis under. And you're going to hold that position, and then you're going to slightly lean forward, making sure your trunk stays upright and you feel a stretch in the front. It's not uncommon to sometimes feel a stretch into your quad muscles also. You can also add a little bit of side bending away to take up slack into those muscles that attach up into the lumbar spine. But again, if you're having low back issues, sometimes I tell people just to stay upright and just focus on the leaning forward, ensuring again that the pelvis stays in that tucked position as you're stretching the muscle.
I hope you got some great insights from Romina. I know that I did, and there's going to be some good things that I move forward with. But I want to know, is there really anything else that you think that we should know moving forward if we want to get started with Pilates?
I think it's important to do your research. I think finding a studio, if you want to do group classes that has 6 to 8 reformers, no more than that, to me is not acceptable, because to ensure people aren't injured and that the teacher can make sure everyone is doing it correctly. So it's an awesome way to exercise. Anyone can do it, but I think, again, doing your research and finding a good studio.
That's great advice. And we also want to know, Romina, where can we find you?
Yeah, so our address is 18226 Mack Avenue in Grosse Pointe Farms. We are on Facebook and Instagram under Tower Fit Pilates, and that should give you all of our information on how to contact us via phone or email.
Michigan, you can come out to Grosse Pointe Farms, and if you're not, then she gave you some great tips on how to find someone locally that could work with you. And then if you just want to connect with them on Facebook, I know that she'll be able to help direct you with some more questions. She's just a wealth of information, and she's a wonderful person, and she's a great physical therapist, great mom, all the things. I'm glad that I could be here today with my friend and introduce y'all to her, and then have her help us with some of those things that we're particularly struggling with, considering a change of life, but also just movement and physical health. Whatever stage of life we are, whoever we are, we need to incorporate good practices for that connection with our mind, our body, and our spirit. So thanks for being with us today, Romina.
Thank you for having me.
All right, guys, until next time.